care for expectant mothers is much harder to find than you might think. 1/3 of North Carolina counties don't have an OB/GYN.
So one option that a lot of people are turning to are midwives, but as CBS 17's Russ Bowen tells us tonight, that too can be a challenge.
Oh, wow.
You can see it, that connection Rebecca Moretto has with baby Abril as she holds her in her arms.
Really be able to connect with that person on those needs, but also just have a really positive celebration of that creation of a new family in a way that is otherwise not possible when you don't build that relationship over the course of time. Go, Mommy.
Moretto is a certified midwife who delivered Abril and provided prenatal care for her mom, Daisy. Until the fall of 2020, Chatham County was one of 30 counties in North Carolina with no practicing physician specializing in obstetrics and gynecology. Mothers would have to travel up to an hour for care and to give birth. That is still the case in areas across the state.
There's about 30 counties in North Carolina that lack any kind of maternity care, and we know that midwifery care could be an answer to that maternity care crisis.
Midwives have helped fill the gap. To qualify, they need a master's degree in midwifery and pass a national qualification exam. But there is another step that midwives say is holding them back.
I call it a permission slip. It's an expensive permission slip, though.
A certified midwife must have a supervising physician, but that doctor does not see or get involved in the care of the midwife's patients. North Carolina is one of only 3 states that require this. A bill to eliminate that requirement is currently stuck in the Health Committee.
Our rural communities are basically like developing countries. You know, it's the access, and that's the fallacy of American healthcare. We spend more than any other country in the world on maternity care for the most abysmal return on investment.
She says it can be a major challenge to find a local supervising physician in rural counties where care is needed most.
I know stories of many midwives who have ended up working in Raleigh or working in Chapel Hill when really they wanted to be working, in Henderson, when really they wanted to be working out in the western part of the state.
For Daisy, safety was a factor in her decision to use a midwife.
If you have someone there to help you, who cares about you, and knows how to do their job, all of your fears start going away.
Moretto says poverty, mothers who work full-time, travel distance to care are less of an obstacle if midwives are an option.
So when you introduce a midwife, you not only see neonatal and maternal mortality and morbidity decrease, but you see the community thrive overall. And I wanted to be a part of that change.
That is so important for women to have that. So, Russ, what happens if there are complications or maybe the midwife knows that this is going to be a difficult pregnancy?
So first of all, these certified midwives, as I mentioned, they're very, very trained, highly trained to spot those issues and can arrange with a hospital to give birth in that setting if they need to. In this case, though, the birthing center is at Chatham Hospital, so that additional help is right there if they need it.